Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Well, we see different injuries with different sports, actually. With skiing, you might see more knee injuries. With snowboarding, there's more often ankle injuries or wrist injuries. Hockey's another winter sport where we see a lot of shoulder type injuries.
Are there things people can do to prevent these injuries?
Some things are just basic conditioning. A lot of injuries with skiing and snowboarding seem to happen the last run of the day when people are fatigued. Other things are protective equipment. You should get your skis checked before you go. Make sure the bindings have been updated or checked, because sometimes if the binding doesn't release, the knee takes the brunt of the injury. Other things are wrist guards for snowboarders. That's really protects the wrist, which is the most common injury with snowboarding, is wrist fractures.
Why are there a lot of shoulder injuries in hockey?
A lot of that is related to the contact of the sport. So as kids get usually in the 10 to 12-year-old range and even up into high school with the increased contact and checking, that's where you see more injuries. So trying to build muscle strength and balance around the shoulder area is something that can be done to help.
What about for the average person who's not on the ice, not on the slopes, but wants to stay active this time of year? Are there certain injuries that they get?
Unfortunately, in New England, we deal with ice in these snowy conditions and always try to be careful, obviously. Slips and falls, we see ankle fractures, broken ankles, broken wrists. So just be careful if you can around the icy conditions.
How does someone know if they get hurt, if they should go home and get rest or seek medical treatment?
A good thing to think of is if you have any deformity in a joint, if something just doesn't seem like it's in the right position any longer, if you have swelling of a joint, that's always a bad sign. If you can't walk, if you can't bear weight on your legs because it hurts so much, you should definitely get checked out.